Hey, I'm Dr. Sandel. I'm an MD. I'm the founder of Opma Clinic in Lawrence, Kansas. And I've been hanging out with Vibrant for, 8 to 10 years, since about the beginning. When I'm looking at a new test, I'm trying to figure out which of the laboratories is doing the best work. There's a lot of competition. There's a lot of laboratories who are inventing all sorts of new stuff. And it's great, right? It's awesome to see all that innovation. But the question is, what actually gets us clinical results? What can we rely on to go to our patients and have a useful set of data, an actionable set of data? Benchmarking before, post-intervention testing. We need both of those things, and we need them with high fidelity. And so whenever we're looking at any particular condition, we want to first understand what are the markers that are useful, and then what lab is going to do that well for us. Always personalized. It always has to be piecemeal. There is absolutely millions of dollars of workup. You're talking about the amount of testing that's out there. And that's not even just in the functional medicine realm, right? In conventional medicine, you can go to Mayo and get the $1 million workup there. And then you can go to a functional medicine doctor and get the second $1 million workup, right? So you really have to figure out what is going to be useful for that individual. It must be personalized. If you have the right testing, you're going to save money. You're going to save costs. We think about the sensitivity and the specificity, which are kind of medically specific terms, but what we mean by that is if we order a test, are we going to have false negatives or false positives for that test? And whenever we're moving into novel biomarkers and people are inventing new tech, there's a lot of risk for that being a little uncertain. And if I order a test for someone and I get a false negative, that's a huge waste of time for them. And perhaps money for them, because we're going to go hunting around everywhere else to figure out, well, geez, what was no, it was the first thing we tested, the test just missed it. Yeah, that's definitely not what you want happening. My favorite test is the test that gets the patient better. That makes me thrilled. Medical conferences ride or die on the quality of the speakers and of the colleagues that you get to associate with. And this has been very high caliber. It's been really, really cool to get to chat with all the speakers, not just to hear from them, but to actually shoot the breeze with them afterwards, which is just awesome. You talk to a world-leading expert in senolytic therapy, and then you can, go brush elbows with them over a drink. That's really, really cool. And then also all of my colleagues that are here trying to advance their own practices. We're all sharing tips and stuff and what worked for you guys, and it's great. A lot of fun. Because the networking probably is my favorite. If you get the right testing for patients, you're going to dramatically increase their trust and compliance in what you're doing. If you can show them the data, one of our speakers at the conference this year did a great job of illuminating this. And he was a little tongue-in-cheek, and he's like, if you show them data, they're going to be worried enough to pay attention to what you're saying. And it's like, not that we want to be fear-mongers on this, but I thought that was very thoughtful. The reality is that everybody has to have buy-in established somehow. And if you have a lab that isn't BS, if the lab really is genuinely telling us something clinically relevant, and you can pass that along the table to the patient, well, that's really important. That is part of the informed consent. Do I want to go through this process with you as a practitioner? Well, okay, there's a piece of data there indicating that maybe I should put up with this. So yeah, definitely very useful.